If you're dealing with lower back pain, it's normal to assume the problem is only in your lower back. But here's the thing, most people never get told your lower back is basically the middle child between your hips and your upper back. And it often ends up working overtime when those two areas aren't doing their jobs well. In physical therapy, we use a concept called regional interdependence. Basically, what happens at one joint can affect a totally different area. Research shows that stiffness or dysfunction in the thoracic spine, your mid-upper back, and the hips can change how your lower body moves and how much stress it has to absorb. In fact, several clinical papers and case series have found that treating the thoracic spine and the hips can actually improve your lower back pain, even when the low back itself isn't the main focus. Let's start with the hips. Your hips are designed to be big, powerful movers. They're supposed to give you flexion, extension, and rotation for things like walking, running, squatting, and lifting. When hip motion is limited, especially in extension and rotation, your body doesn't just stop moving. It figures out a workaround. A lot of that extra motion that shows up in the lumbar spine, studies have shown strong relations between limited hip mobility and changes in lumbar movement. For example, when hip extension is restricted, people tend to rotate or extend through their lower back, which can contribute to repetitive microstress on the lumbar joints and soft tissues. Other work in athletes and active populations have also linked reduced hip mobility to altered pelvic mechanics and increased loading on the lumbar spine, especially during running, squatting, and cutting movements. So what does that mean in real life? If your hips are stiff, your lower back often becomes the substitute joint. Instead of the hips turning, extending, and absorbing load, your lumbar spine bends and twists more than it's designed to. Over time, that extra workload can show up as tightness, fatigue, or pain in the lower back. The encouraging part is that targeted work on hip range of motion and strength, especially the glutes and hip rotators, have been shown to reduce pain and disability in people with low back pain when it's added to their rehab. Now let's talk about the thoracic spine. The mid-back area where your ribs attach, this region is supposed to give you a lot of your rotation and extension. If the thoracic spine is stiff and doesn't rotate or extend well, that motion has to come from somewhere else, and the lower back is usually the one that picks up the slack. Clinical frameworks for spine rehab highlight that improving thoracic mobility and control can change how forces were distributed through the neck, shoulders, and lumbar spine, and may help symptoms even when the low back is the main complaint. Think of your thoracic spine as an upper shock absorber and steering wheel. If it's locked up, the low back gets yanked more with every rotation, reach, and overhead movement. Put together, limited hip mobility from below and limited T-spine mobility from above can box in the lumbar spine. Instead of being one contributor in a well-balanced system, your low back gets stuck doing more bending, twisting, and absorbing load than it's happy with. That's why a modern, evidence-informed approach to low back pain doesn't just chase this painful spot. It often includes exercises that restore motion and strength at the hips and thoracic spine, along with trunk control, general movement, and lifestyle factors.